Hello everyone, welcome to physioBRAIN. This is Professor Adriano, and today we're going to talk about a very relevant and little known topic. Have you ever heard of the disease called cystic fibrosis, or cystic fibrosis, or mucoviscidosis? Stay with me, because we're going to explain a bit more about these topics today. And don't forget, go ahead and subscribe to the channel, leave your like, write, and share it with anyone you think needs to know this information. Let's spread the word, let's create this chain of good, sharing health information. After all, what exactly is cystic fibrosis, or the disease of cystic fibrosis, right? First of all, this term, the disease of cystic fibrosis, was a way that a mother used to make the disease seem less severe, a way to explain to her child what illness he had, right? So in English, it's cystic fibrosis, which sounds very similar in pronunciation to 65 roses. So it became a play on words to make it a lighter way to talk about the disease, right? So it would mean, the disease of 65 roses, which is cystic fibrosis. It's a hereditary disease, right? That especially affects children because its development already appears in childhood, in which there is a deficiency of a gene and its protein causing an excessive production of mucus in the lungs. This excessive production is 30 to even 60 times higher than normal, right? So if a child produces a certain amount of phlegm, of mucus, right, of pulmonary fluid, this child will have their fluid produced in much greater quantity. And this fluid, this mucus that is produced, becomes thicker, right? Extremely thicker, more viscous, and that's why the disease is so serious, right? It affects the lungs, and the fluid that is produced there becomes difficult to eliminate, right? So the child has trouble getting rid of it, coughs a lot, and expels huge amounts of secretion. So we need to pay close attention to identify it, right? The diagnosis of the disease is usually made through the heel prick test, right? So in the heel prick test, the disease is identified, which is cystic fibrosis, right? And what is very common to happen, sometimes even before the heel prick test, is that the mother notices that the child has, let's say, the so-called salty kiss, right? The mother goes and kisses the child and notices that sometimes the sweat or the child's skin tastes saltier, which is a sign of the disease. So the salty kiss disease is also, it's a term that's often heard to describe cystic fibrosis. This disease affects children and has its consequences, especially in the lungs, pancreas, and intestines. So the child faces some difficulties and needs to make dietary adjustments and take nutritional supplements. So the child needs follow-up care with a nutritionist and a doctor, right? And the more physical therapy and well-prescribed physical activity this child does, the better it is for them. Because what will be necessary, that they are constantly clearing out this secretion. And we know that physical therapy does a fantastic job in terms of thinning, removing, and eliminating these secretions through respiratory physical therapy, through mobilizations and motor physical therapy, which plays a very important role in this regard. So the disease of cystic fibrosis or cystic fibrosis is a serious disease, a serious respiratory disease in childhood, and we need to talk more about it. So our idea here was to encourage you to look a little deeper into cystic fibrosis, right? And especially so that we can start to identify if, someone we know has any kind of symptoms like these. We need to stay alert because it is a serious respiratory disease, all right? So if you have any questions, write them in the comments, subscribe to the channel, and share the video. Take care, and I'll see you in the next videos.